Hi everyone, I'm Dr. Anusha Rathi, your microbiology faculty at PW MedEd, and today I am here with a rather interesting session. आज हम यूज करने वाले हैं AI to own our skills as a doctor. सबसे ज़्यादा बड़ी प्रॉब्लम होती है कि बुक्स तो पढ़ लिए, वी रिमेंबर ऑल द थ्योरी, बट जब एक्चुअल पेशेंट सामने आता है तो हिस्ट्री टेकिंग के टाइम पे सारी बातें भूल जाते हैं. Of course, to help you guys, our expert faculty has the pocket clinic series on YouTube, and I hope you have checked it out because it is very very beneficial. नहीं देखा है तो अभी जाके देखो. Until such a time, today I am going to use Google Gemini to pretend to be like my patient. क्या आपको पता था? You can give prompts to Gemini and do a role play with it. सो आज हम रोल प्ले करने वाले हैं एक डॉक्टर और एक पेशेंट का. मैं जेमिनाई को बोलूंगी टू कम टू मी विद सम चीफ कंप्लेंट्स. धीरे धीरे करके आई एम गोइंग टू एक्सट्रैक्ट आउट ऑल द डिटेल्स. हिस्ट्री टेकिंग में क्या इंपॉर्टेंट पॉइंट्स हैं, जो वो मुझे हिस्ट्री देगा उसमें इंपॉर्टेंट पॉइंट्स को पकड़ूंगी, एंड देन वी आर गोइंग टू गेट इन्वेस्टिगेशंस एंड ट्रीट अ फुल पेशेंट. सो कम जंप विद मी. सो ऑफकोर्स बिहाइंड मी दिस इज जस्ट अ गूगल शीट एंड हम इसमें जेमिनाई ढूंढेंगे. वी आर गोइंग टू क्लिक ऑन जेमिनाई एंड इट्स ओपन. Best part is I need not type a lot. I can simply give voice prompts to Gemini. So चलो उसको prompt देते हैं to act like my patient. Okay. Hi Gemini. Pretend to be my patient. I am your treating doctor. Walk into my clinic, which is a medicine OPD, with complaints which will ultimately amount to tuberculosis. Of course, since you are a patient, you don't know that you have tuberculosis. So while giving the history, please presume any possible clinical diagnosis. Tell me the history as and when I ask you the questions. Then I will ask you to get some investigations done and present the lab reports to me when asked. Shall we begin? Okay. So now it's going to come to me as a patient. Let's see what history it brings me. So it's totally unknown. It's totally like how a patient can come to you. Okay? A patient can walk into your clinic and they can say absolutely anything to you, right? I'm ready to begin. I will answer your questions. Take a seat. Good afternoon, doctor. Thank you for seeing me. I came in today because I've been feeling completely exhausted lately and I have this awful cough that just won't clear up. I honestly thought it was just a stubborn winter cold and maybe a chest infection, but over a few months, it seems to not be getting any better. So typically, जैसे एक टीबी का पेशेंट आके बोलेगा कि बहुत टाइम से बस अच्छा फील नहीं हो रहा, शाम के टाइम बहुत थकान हो जाती है और ये कॉफ है, ये जुकाम हुआ है जो जा ही नहीं रहा है 1 महीने से, राइट? सो ऑफकोर्स अब आपको लीडिंग क्वेश्चन पूछने हैं उसे. इसने मुझे बताया है सिर्फ कफ के बारे में एंड फीलिंग एग्जॉस्टेड. कोई पर्टिकुलर फीवर की हिस्ट्री नहीं दी है. सो लेट्स आस्क, for how much time have you had this cough? Is it a dry cough or is it associated with any phlegm or sputum production? Do you also have any complaints of fever, loss of appetite or weight loss? So now I have given it some classical history based on the history that Gemini gave to me. सिंपली उसने बोला कि नॉट फीलिंग वेल एंड कफ. तो अब हम कफ के आगे की लीडिंग हिस्ट्री पूछेंगे और फीवर एसोसिएशन पूछेंगे. उसने बोला है 4 to 5 weeks कफ. सो ऑफकोर्स दैट फिट्स इनटू माय कैटेगरी ऑफ मोर देन 3 weeks कफ. एट फर्स्ट it was dry, but over the couple of weeks it has started to become thick yellowish phlegm, obviously pointing towards a bacterial involvement. Couple of days ago I noticed tiny streak of blood in it. That is what pushed me to make an appointment. As for other things, I have been feeling feverish, hits me in the afternoons or evenings. So of course there is evening rise of temperature, low grade, and I wake up in the night drenched in sweat. Evening rise of temperature, evening sweats, prolonged cough, सब बता रहा है मुझे पेशेंट. एपेटाइट भी चली गई है. फोर्स माई सेल्फ टू ईट. आई हैव डन weight loss and I haven't stepped on the scale but my pants are noticeably loose. ऐसे ही बोलता है पेशेंट. कोई पेशेंट वेट मेजर करके नहीं आता है आपके पास, बट दे टेल यू कि ऐसा लग तो रहा है, राइट? सो दिस इज kind of almost telling me that this could be tuberculosis. So now I'm going to tell the patient and this will help you practice कि आप एकदम से bombard नहीं करते हो patient को, how you have to break the news to the patient. So I'm going to say, since we are living in India and the most common disease that we get is tuberculosis, so nothing is confirmed as of now, but I am going to advise some investigations so that we can confirm the diagnosis of tuberculosis. Please don't be scared because it is a treatable disease. And right now, just go and get a blood investigation, which is CBC, and give one single sample of sputum to the lab for the test called as ZN staining for AFB. Once the report comes, please show to me and then I will lead you further how to go ahead. So of course, you don't bombard the patient with many investigations and you don't scare them at first. So I am having a doubt of tuberculosis. So I will simply get a CBC and one single sputum sample, and then I am going to, lead the patient first. Tuberculosis, honestly, doctor, bit scary. All of this the patient is going to tell you. I will get the sputum sample and blood drawn. Good afternoon. Now the pathology report has come to me, which is telling me that hemoglobin is fine. TLC is a little bit raised on the higher side. Neutrophils is 68%. It is the lymphocytes which is giving me, slight increase. And it looks more or less all right. What is important here to notice is the ESR. ESR is markedly increased in this patient, which is a pointer of a chronic illness, possibly an infection. And the ZN stain has shown me 2+ positivity of acid-fast bacilli. This is direct sign that patient has tuberculosis. Now what do? Should I just label the patient as TB, or should I ask for more investigations? So I am going to ask more investigations. So based on your reports, there is direct evidence of presence of tuberculosis bacteria in your sputum. So for further confirmation and to confirm what treatment to give you, I need to advise you a repeat sputum early morning sample which you have to give. Please give the sputum first thing in the morning after waking up without even brushing your teeth. Send it for ZN staining. Also send the sputum sample for GeneXpert testing so that I can get to know about rifampicin sensitivity. And please follow up with the reports to me. So that is how we have taken it in a sequential manner, and this is the manner in which you actually attend to a patient of tuberculosis. So it really is tuberculosis. It is overwhelming, just to be honest. So this is where you need to counsel your patient a little bit, make them feel better. Now the microbiology report have come, and early morning sample is showing me a 3+ positive sample. So this is showing me कि on the spot sample में थोड़ा सा कम obviously load is there. That is why I ordered an early morning sample, which is showing me the true picture of the bacterial load inside this patient. This is also important to understand that this patient is further infectious. GeneXpert में क्या आया है? MTB detected and rifampicin not detected. So this is a rifampicin sensitive case of Mycobacterium tuberculosis. I will give off the final words. You have a good news as well as a bad news. Bad news is that you have confirmed tuberculosis, but the good news is that this is very much treatable by using antibiotics. It is a susceptible strain, so I am going to give you a full course of first-line antibiotics for tuberculosis. Please take the full course. Do not stop it in between. Keep follow up. Also, would you like to tell me if you have any less than 5-year patients or immunocompromised patients inside your family? So of course, the Gemini is going to give me a response after this, and overall from here you take it up how you want to counsel the patient, etc. But like you saw, Gemini behaved like my patient, gave me the history in the manner that the patient gives me, gave me important clinical cues, and I had to build it up after that. So you go ahead and you do the same thing, pick up the disease of your choice, give the prompt to Gemini and practice before you go for your final exams and before you actually go into your clinics and face the patients. Hope you enjoyed the session. Do not forget to watch the Pocket Clinic series on YouTube, and very soon I will see you in class.